The World Health Organization has approved the emergency use authorization of some COVID-19 vaccines to stem the pandemic. To this end, few countries have commenced vaccinations. This week, our focus is on the pre- and post-COVID-19 immunization process. I am Olasumbo Modupe. Welcome to Sound Health. We begin with COVID-19 updates. Please stay tuned.
COVAX has announced the signing of an advanced purchase agreement with Pfizer for up to 40 million doses of the Pfizer-BioNTech vaccine candidate, which has already received World Health Organization's emergency use listing. WHO says rollout will commence with the successful negotiation and execution of supply agreements in further support of its mission to expedite early availability of vaccines to lower-income countries and help bring a rapid end to the acute stage of the COVID-19 pandemic. COVAX also confirmed that it will exercise an option via an existing agreement with Serum Institute of India to receive its first 100 million doses of the AstraZeneca Oxford University-developed vaccine manufactured by SIL. Of these first 100 million doses, the majority are earmarked for delivery in the first quarter of the year, pending WHO emergency use listing. The WHO review process, which is currently underway, follows approval for restricted use in emergency situations by the Drugs Controller General of India earlier this month, and is a critical aspect of ensuring that any vaccine procured through COVAX is fully quality assured for international use. According to the latest WHO update, a decision on this vaccine candidate is anticipated by the middle of February. COVAX also anticipated that via an existing agreement with AstraZeneca, at least 50 million further doses of the AstraZeneca Oxford vaccine will be available for delivery to COVAX participants in the first quarter of 2021, pending emergency use listing by WHO of the COVAX Pacific Manufacturing Network for these doses. A decision on this candidate is also anticipated by WHO in February. The Presidential Task Force on COVID-19 has confirmed that the B.1.1.7 variant found in the UK has been identified in Nigeria. The chairman of the committee, Boss Mustafa, explained that 4 persons have been diagnosed with it, adding that while 3 were travelers from Nigeria to other places, the 4th case was discovered in the country. He also added that the federal government has extended phase 3 of ease COVID-19 lockdown by 1 month. Mustafa said that the government is reviewing the guideline on the eased lockdown and will announce soon in order to beat the pandemic. Out of 20,119 prospective National Youth Corps members tested in the orientation camps in the current stream, 765 have tested positive for COVID-19. NCDC said they were found positive using the new antigen-based rapid test kits in the country. The Lagos State government has revealed plans to achieve seamless rollout of COVID-19 vaccines and efforts to bolster mass vaccination of residents in the state. Governor Babajide Sanwo-Olu says the state is aiming to achieve 60% vaccine rollout when the vaccination program begins in the coming weeks, stressing that the figure would help check rate of transmission and build the resilience of the state against the ravaging virus. Governor Sanwo-Olu also added that the state government did not have the plans to make the COVID-19 vaccine available to all residents, as the state will not have the resources to do that, but critical segments in the state population will be vaccinated to achieve herd immunity against the pandemic. Till date, over 122,000 cases have been confirmed, about 98,359 cases have been discharged, and more than 1,500 deaths have been recorded in 36 states and the Federal Capital Territory. Globally, there have been more than 98.7 million confirmed cases, including over 2 million deaths reported to the World Health Organization.
Thanks for staying with us. Today, we are honored to have Dr. Chibuzo Ndukwu share his COVID-19 vaccination experience on the show. Welcome to Sound Health, Dr. Ndukwu.
Thank you for having me.
Okay, Dr. Chibuzo Ndukwu is a specialty registrar, general and geriatric medicine. He is joining us from Aberdeen, Scotland via Skype. We are glad to have you on the show, Dr. Ndukwu.
Thank you.
Okay, you have had the privilege to be vaccinated. Tell us, how did it go?
I think it's just like having any other vaccination, really. The first thing, of course, is you be asked a few questions about, if you have any ailment or if you have any problems, medically, to try and see if you have any contraindication for having the vaccine. For example, if you remember very well when you want to go for a vaccination, one of the things you're going to be asked is if you have any ongoing fever or if you have any previous allergies to any previous vaccination. Also, if you are someone who is on any medication that, for example, thins your blood, for example, if you are on what we call anticoagulants, for people who have some irregular heart rhythm, they are on some of those medications because if you get the vaccines, because it's an injection into the muscles, it can increase the risk of bleeding in such patients. So they do ask,
Okay, were you booked for the process? Was it mandatory? Share with us the details.
So when the vaccine, of course, was approved in the UK, the first thing was there were memos sent out to, of course, frontline workers, which involved the doctors, and they also looked at other criteria like the elderly people in care homes and other vulnerable groups.
Okay.
So memos were sent out and you responded. So either you go online through your hospital means, you can book, or there's a phone number you can call and you can get allocated a time slot for you to come in for the vaccination.
Okay, let me ask you, Dr. Ndukwu, was it free?
Yes, it's absolutely free.
Wow.
We're not paying anything for it. It's absolutely free.
Okay, what brand did you get and how many shots did you get?
I've had the first dose of the Pfizer vaccine. I had it on the 8th of January. The plan, according to the WHO, the initial plan was to have the first dose and have a second dose, which is the booster dose, on 21 to 28 days after.
Okay.
However, because the government is trying to vaccinate as much people as possible, they have extended that time frame to about 12 weeks.
Wow.
Because from their own record and, of course, from the data available, your first dose should be able to give you an immunity of up to 50% or more. At least that kind of protects you from the virus, gives you a bit of immunity. Not really, you can still have the virus, but just that your ability to kind of resist being unwell is much higher.
Okay, so definitely you're going to get a reminder for your next appointment.
Oh yeah, definitely. So of course, when you get your first dose, you automatically get booked for the second dose. So you get a reminder, either you get a text message for those possibly maybe in the community, but for the healthcare workers like the doctors, you probably get an email which automatically tells you when you're supposed to come in for your vaccines and that's how it is.
Okay, did you have any fears or doubts about the vaccines?
I'll be honest. So, of course, it's all about data. So when the data were coming out, everyone was very cautious, about, taking the vaccine. But the data has shown that it at least confers level of immunity. And again, for me as a doctor, I do work in the acute sector, and I've seen the devastating effect of the virus itself. And I'll be honest, I was, I was a bit taken aback, and I said, there's no harm. It's better to at least be protected to a large extent than being, exposing yourself and also your family to the dangers of the virus.
Okay, share with us your post-vaccination experience. Did you have any side effects?
Well, yeah, I did. I'll be honest about that. So the first, of course, when you get the vaccine, the day you get the vaccine, after you get your shot, you are kept for at least 15 minutes within the space where the vaccination is being held, maybe in another room. You are observed there for that time frame to see if you have any allergic reaction or if you become unwell after taking it. After 15 minutes, if there is no effect, you are allowed to go back either home or back to work. Of course, one of the main side effects is pain at the site of injection. Also, you can also develop symptoms such as headache, joint aches. You just feel a bit you feel as if you're having malaria kind of symptom, joint pains, fever, and all that. Now, in my own case, I had headache, I had joint pains, but I didn't have any fever. So, and that just lasted for 24 hours, really. So I just took paracetamol, and by the next day, I was as good as normal.
Okay, so I was going to ask how you managed the side effects, but you've answered that. Did you hear about any death recorded as a result of the vaccination?
Well, no. At least for now, we've not heard any. There's no record of anyone who has taken the vaccine that has, there's any death recorded from that, process. So I will say for now, no. I'm very sure the government are keeping close eye on that just to see if there's anything, but not at the moment.
Let me ask you this question, Dr. Ndukwu. Can you still transmit COVID-19 or can you contract the virus after the vaccination?
Yes, you can. So it's just like, let me just use let me just kind of explain a bit. It's just like back home in Nigeria where you were exposed to a lot of malaria, parasites, from mosquito. Now, taking anti-malaria prophylaxis doesn't mean you won't have malaria, or if I run a blood test, you won't have malaria in your system. It's so that you might not be unwell with the parasite. It won't cause so much problem. It's the same way with the virus. So being vaccinated, at least having the first dose, reduces your. It doesn't confer. Doesn't mean you won't get the virus. It just means that you won't become unwell with the virus. So that's one of the good effects of that, having the vaccination.
Okay, as a doctor, tell us, should you still wear a mask after vaccination?
Yes, it's very important. You should wear a mask because you are still being exposed and you're still a carrier of the virus. So wearing a mask reduces your ability to transfer or rather transmit the virus to people around you, even at work or even any form of little gatherings that people still do go to, especially back home in Nigeria. So even if you've had the vaccine, you still need to wear a face mask.
Okay, what should key players do to allay public fears and encourage acceptance of the vaccines?
Well, I think one of the ways is to first of all, be very open about it, do a lot of, information dissemination, very important. And also one of the ways you can elevate the fear in the populace is to what they've done in Europe, and I'm very sure if you looked at all over the world, you see the leaders of the nations take the vaccines on air, take it in public, and people see that, okay, if my leader is taking this vaccine, that means, of course, they also believe in it, and that gives them a little bit of a confidence that, this is the right thing to do. And of course, information is important. I know there are fears out there, but the right information helps people to make the right decision.
Okay, now let's look at the low and middle income countries. How do you think accessibility, storage, and distribution can be achieved?
Well, so for now, if you look at, I think I'm not sure about the three vaccines now. I know the Pfizer one is stored about minus 70 degree centigrade temperature. I think the AstraZeneca is also minus 20, if I'm not mistaken. And the third one, which is also very common, I think the Moderna, is possibly I think room temperature. So I'm not sure now. But however, what the low resource countries can do, considering the facilities available, is to try and lay their hands upon the ones that can be easily stored in their own environment. I mean, it will be very difficult for people back home in Nigeria, for example, to try and get the minus 70-degree Pfizer vaccine because we might not have the facility. That is not saying that it cannot be available, because of course we know there are cold, facilities that can store these things at that temperature. All it requires is just proper planning and logistics, and this can actually be achieved.
Considering the rising cases, do you think the virus is going anywhere soon?
Pardon? I didn't get that.
I said, considering the rising cases, do you see the virus going anywhere soon?
Well, for now, with the data available, it's difficult to say. But I suppose, for the next 6 months or more, the virus is still going to be around, very much around. However, with the massive rollout of the vaccination, I think the numbers of people going to become severely unwell with the virus will be much lower. I think that's the main drive. The main drive is not to totally exclude the virus itself in the community, is to reduce the severity of the virus, affecting people.
Thank you so much, Dr. Ndukwu, for your time and expertise.
Thank you very much. Thank you very much.
Okay, it has been a privilege to have you share your COVID-19 vaccination experience with us. Okay, well, you have heard from the horse's mouth. The vaccines are safe. Prepare to get one when vaccination starts in the country. Dr. Ndukwu has been sharing his COVID-19 vaccination experience with us via Skype from Aberdeen, Scotland. Dr. Chibuzo Ndukwu is a specialty registrar, general and geriatric medicine. Sound Health continues with trending health reports. COVID-19 vaccines are safe and key in stemming the pandemic. However, non-pharmaceutical measures such as regular hand washing for at least 20 seconds, use of face masks and physical distancing are very vital. Please stay safe always. That's Sound Health this week. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at HealthTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.